Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I'm professor of medicine, Buenos Aires School of Medicine, as chief of plastic surgery Penn Hospital, director Hoogstra Medical Corporation. I'm going to talk about periorbital rejuvenation and the procedure that I perform since 25 years. Always I said that the aging process is more related to the dropping of the tail of the eyebrow than the flaccidity of the skin of the upper eyelid. Here we can see clearly that this patient have almost not excess of skin of the upper eyelid. All this is skin from the eyebrow that was dropping. Here is the tail now, and here was the tail when it was young. Many patients come to different clinics like this, and all the medical doctor propose a resection of the skin of the upper eyelid, but this is no upper eyelid skin, this is the eyebrow skin. And also this patient can go to any plastic surgeon around the world and they are proposing to remove skin from here. That is the eyebrow skin. And also if this patient go to many centers and all propose resection of the skin. Why almost all plastic surgeons around the world propose a skin resection of this skin resection when the problem is the dropping of the eyebrow? Because it is easier to remove skin here than the reposition of the eyebrow and forehead skin. Why? Because these are the technique they're using for the reposition of the eyebrow. This skin resection, the hairline, the resection inside the hair, or this coronal leaf. But also the endoscopic brow leaf leave big scar, just 5 scars, almost 6 centimeters each one. You can see here the big resection because use a large instrument to decollate the frontal area. Here you can see what I say is almost 6-7 centimeters longer. They do not remove skin. They reposition but left big scar. For this reason, it's easier to remove upper eyelid skin that really is not upper eyelid skin. This is forehead skin. Here you can see with endoscopic brow leaf nearly 8 centimeters in the temporal area. And this is all the technique that are using around the world. Coronal lift, this resection, these are from the endoscopic that we saw in the last, or this resection, this one, and the result is this big scar. This is the technique, the resection of the skin, and is very and all then also remove skin of the upper eyelid and the eyebrow skin with this big scar, and the result of this is a tired look, sad look, and old look with a big scar. You can see here this kind of complication, lack of thalamus, scar, this sadness, the scar here, the scar, and this terrible result. And this resection, this one, young patient with this resection, this technique, lack of thalamus, this one, ectropion, and meanwhile the aging process is like this and produces satire. If we resect here skin, we are going to produce a sadder tire and all expression, tie expression. And also the blepharoplasty produce the same. You can see a cadaveric upper eyelid, and the tire is a young patient, 23 years old, that I propose a minimal incision here to remove the upper eyelid fat pad, the tightening with laser, and this is how we remove the upper eyelid. And this is the result with reposition of the eyebrow, and you can see the change of the expression of the look of this patient. Just I only produce reposition, and for this forehead I develop a technique, just 3 small incisions inside of the hair, 1 centimeter or 1.5 centimeter, that would don't leave a scar, visible scar, do not remove skin. And this is the conventional technique that but this patient come from outside of the country and went to see many plastic surgeons around the world. All propose resection of the skin, and thank you my nearly 2,000 educative videos. He came to my office, I produce a reposition, and you can see this is a bald patient and have no scar. But if the plastic surgeon use endoscopic technique or conventional resection skin coronal lift, is going to leave a scar here, and it is impossible to bear to this patient. Then it's easier to remove skin here, but you can see with the result immediately after the procedure without scar, a nice looking how improves the expression of this patient. It's just almost 1 month after the procedure of this young patient with the position of the eyebrow here, and this is 40-hour post endoscopic, my personal technique, and I reposition the forehead with almost 2 stitches inside of the hair that are removed 14 days after the procedure, and remove all these strips. Okay, I really don't remember the name. I remove this 7 days after the procedure, and this is the result. 7 days, 7 days, 7 days, and you can see the change of the expression. Patient look a change of the expression. They look for minimal invasive procedure without scar, and I propose. My commitment is to teach many plastic surgeons around the world to use this technique and make the patient look nicer, younger, natural, without scar. But also, if the plastic surgeon do not learn how to use carbon dioxide laser, they are not going to improve all these wrinkles, because it is impossible with a conventional technique, resective technique, improve this. The history of this patient was removing skin from the upper eyelid, and you can see how they drop the tail, the eyebrow, and ectropion, and they don't improve this. This is with my technique, endobrow with minimal incision, rejuvenation with a laser. The future is improve the quality of the skin, change resection skin for rejuvenation skin, and my commitment is this. You can see 7 days, no scar at all. Of this patient went many plastic surgeons, and all they propose skin resection of this area, and this is the result of my technique. We change the vertical oval from horizontal oval, and how all this patient, all this one. I hope you enjoyed this presentation.